Hello all, welcome to NUR 341 and NUR 342 clinical courses. As you know, these clinical courses, unlike last year, it is 2 days per week. As you already know, we are having two groups, one on Tuesday, Wednesday, the other one on Thursday, Friday. This is a brief mini course orientation. Further details will be shared whenever you are introduced into a new clinical setting or a new clinical hospital. Important things to note regarding this course is the distribution of the grades. The grading policy is a bit different because the weekly evaluation will be will have a weight of 70% of your grade, unlike the previous clinical courses, because you are now more skilled, you have better dexterity, you are more at ease with all the clinical skills we are doing with the care plan, with the documentation, with physical assessment. That's why the weight of the weekly evaluations will be 70%. We are using the same system, which is U, SA, SU, and I. Hopefully you will do your best and reach your maximum potential and all get the best grade possible. In case, unfortunately, one got a U this semester due to a breach in the critical element, this U will be organized in a way so that if your grade is ranging from 70 to 60, you will receive U1, from 60 to 50, U2, from 50 to 40, U3, and so on and so forth, so that you have a general idea about what your numerical grades are. Nursing assessment forms have 12.5%, nursing care plans have 15%. You will have a new assignment called concept mapping. This assignment you will be comparing two patients who have different exemplars belonging to the same concept. For example, you might choose the concept with the help of your instructor. You might choose the concept of oxygenation. Two different exemplars would be pneumonia, for example, and COPD. Or bronchitis and lung cancer. Those two exemplars should belong to the same concept, and the student will compare these two exemplars and these two patients, the different physical assessment findings, the difference in pathophysiology and in the management. This is something that you do instead of a care plan, and there is no need to submit a physical assessment form because all the information and all the details related to the case are documented by you as students on the same concept map form. You will be also writing a NICU report. Guidelines are posted on Blackboard, and you will be further oriented about the NICU report by Ms. Noura, Ms. Hanad, and Ms. Mira Abisad. A kind reminder that you need to attain a minimum of 70% on the weekly evaluations in order to pass this course. I would also like to stress the rules and regulations regarding your attendance. We should attend every day, each and every day, because in the clinical courses, it is very similar to your work as registered nurses. And as you know, attendance is really obligatory in nursing. The only excuse is for you to skip a clinical day due to medical reasons. In case of sickness, this would be evidenced by a medical report that you will get from your attending physician to be evaluated by the faculties so that your absence is excused. if you think you are suffering from COVID or COVID-like symptoms, إذا في any suspicion that you were exposed to COVID or you are suffering from COVID-like symptoms, you need to communicate with Miss Maria and copy me so that she may follow up on your case. So your absence will be excused only if you are following the email of your absence with a medical report or an email from Ms. Maria explaining that you need to be confined and further evaluated for COVID. So these are some examples for unexcused factors that will lead to unexcused absenteeism. Unexcused absences need to be kept in the student file. You will have to do a make-up day assigned by the faculty. To this make-up day, you will not receive transportation, and you will have one letter grade deducted from the final grade, similar to every clinical course and every clinical year. I would also like to stress the dress code because, as you know, beards are not allowed in the clinical settings. For females to have clear nail polish in certain or to follow the hospital policy, artificial nails are not allowed, visible tattoos, the hair should be neat and tied back, and for men, facial hair is not allowed as part of your policy. If you have any further questions, we may follow up with other Q&A session if you would like. You will receive unit-specific orientation by the assigned faculty. For example, in the community setting, you will have further orientation by Ms. Sarah or Dr. Mirna Dumet regarding the assignments that you will be submitting, such as patient education and community report. And in the pediatric floor, your NICU reflective writing, as well as the floor-specific care plan and physical assessment. Or you will also be asked to submit an OR report, part of your operating theater rotation, which will be further elaborated on by Mr. Joseph Aborjaili in due time. Furthermore, other assignments are the routine ones that you have been submitting since the beginning of the year, which are a physical assessment form and a care plan. This year, your care plan will have 2 nursing diagnoses instead of 1 because you are attending to the clinical and taking care of the patient over 2 consecutive clinical days. That's why you submit 2 nursing diagnoses care plans. Thank you all for your time. I look forward for this semester and this clinical experience. Please go over the syllabus in details, and if you have any further question, do let me know.